wet cloth, wet mop to try to remove the dust. Dust mite has very specific remediation, so washing bedding in hot water at least weekly, using encasings for the bedding is helpful, dust mite proof covers for bedding, pillows. The dehumidifiers can help as well.
Good information about how to reduce dust and dust mites. If you are a new grandparent, as I am, you're thinking about things like this. Of course, new parents certainly take a lot of precautions to safeguard their homes as their babies grow. But as they add things like electrical outlet covers, cabinet locks, and baby gates, there's an important health threat that often goes overlooked. Barb Consiglio has more on why it's important to consider the air quality in your home and the simple steps that you can help to clear the air.
I think air filters are one that should go on every baby registry. Like, even if you're a super healthy mom and asthma doesn't run in the family, having an air filter in baby's room is so important.
Clip it in. Like any mom, Erica Boniface's top priority is her children's safety. Yeah. For 6-year-old Josie, who has asthma, one of the biggest safety concerns is her breathing.
So this is her room. So we got rid of all of the carpet and make sure I wipe down the walls. And we always have a cool mist humidifier by her bed.
While Erica has good reason to be extra vigilant, Dr. Michael Nevid, a pediatric immunologist at National Jewish Health in Denver, says improving indoor air quality is something that should be on every parent's child-proofing list.
People spend somewhere 90%, maybe 95% or higher of their time indoors. So having a safe environment at home is important for keeping our children healthy. If you have gas stove or other gas appliances, make sure that there's adequate ventilation. So if there's a hood, to make sure that you're turning on, the range hood to help filter out some of the gas that's being emitted. Another option, if you're able to do electric-based appliances, electric stove tops would produce less of that.
Eliminate secondhand smoke, which is linked to the development and exacerbation of childhood asthma.
Doing layers of fresh paint, good paint. We did mold testing. We even had our air tested, where they bring out these big tubes and they test for 3 days what kind of chemicals and hazards are in our air so that we know.
Next, replace furnace filters and have your vents cleaned regularly.
We do air duct cleaning twice a year because, that's the stuff that's moving around in your house, stuff you just don't see.
Clear the air using vacuums and purifiers with HEPA filters that remove harmful air pollutants, and regularly clean surfaces with products free from harsh chemicals.
Another issue for a lot of our patients are fragrances, so trying to avoid very fragrant chemicals would be helpful.
It's also important to know when to let the fresh air in and when to keep the windows closed. By monitoring air quality alerts and talking to your doctor about allergens and irritants that affect your child's breathing.
Another important thing is to make sure that if a child does have asthma going into the winter viral respiratory season, that their asthma is as controlled as it can be. So making sure that they're following with their physicians to make sure that if they are hit with a virus, if their breathing is as optimized as it can be, they might not have as significant of an exacerbation.
Their lungs are developing. The little ones, even though they're born, their lungs are still developing. So it's just important to think about, even if you don't have lung disease or asthma, because they're growing, and it just kind of helps make them stronger and healthier in the long run. We track the air in our house.
For Erica, knowing the air in her home is clean gives her peace of mind.
It shows that we were kind of in the red zone from 3 a.m. to 6 a.m. And right now we're totally good.
And ensures Josie's asthma won't slow her down.
Getting a diagnosis like asthma is scary. You automatically picture the kiddo that is on the bench, that can't do certain things or can't go out, and that's just not the case.
At National Jewish Health, I'm Barb Consiglio.
Experts stress that frequent hand washing and staying up to date on seasonal vaccines are also important steps, as respiratory viruses like the flu and COVID can trigger asthma symptoms. For those looking for asthma-safe products for their homes, the Asthma and Allergy Foundation of America has a list of certified safe products on their website, aafa.org too. Up next on Jenny, a look at some of the most popular New Year's resolutions.